Hello everyone, today I'll be talking about primary hyperparathyroidism. As the name itself suggests, it is hypersecretion of the parathyroid hormone due to defect of parathyroid gland itself. These defects can include diseases such as parathyroid adenoma, parathyroid gland carcinoma, or primary hyperplasia. These disorders can have familial association with multiple endocrine neoplasia, or say the MEN syndrome, wherein parathyroid adenoma or primary hyperplasia are one of the components. Clinical features of primary hyperparathyroidism can include stones, which can include nephrolithiasis and or nephrocalcinosis, abdominal groans, which can include diseases like peptic ulcer, pancreatitis, and cholelithiasis. Psychiatric moans, which can include behavioral and neurotic problems with depression and anxiety. Bones, which include bone pain, which can be associated with disorders such as osteitis, fibrosa cystica, arthritis, and osteomalacia. Also, there can be development of metastatic calcification in other tissues such as blood vessels, cornea of the eye, etc. Investigations for primary hyperparathyroidism can include estimation of levels of the parathyroid hormone, estimation of serum electrolytes, estimation of serum phosphate levels, and estimation of levels of alkaline phosphatase, and also estimation of serum 25-hydroxy vitamin D levels. Investigations can also include radio imaging techniques such as X-ray, an ultrasound, and a CT scan. Also, some other investigations may be advised, some of which include selective venous sampling for parathyroid hormone and scintigraphy with technetium 99M, Sestambi. Once the diagnosis of primary hyperparathyroidism is established, then its management includes a combination of treatment of the underlying cause, which may require surgical intervention, along with supportive therapy, which can include correction of hypercalcemia at an optimal rate. Just a few points of differences between primary and secondary hyperparathyroidism. Primary hyperparathyroidism, as the name itself suggests, is hyposecretion of parathyroid hormone due to disorder of the parathyroid gland itself. Secondary hyperparathyroidism, on the other hand, is hypersecretion of parathyroid hormone secondary to hypocalcemia occurring due to disease elsewhere in the body. The disorders of parathyroid gland itself in primary hyperparathyroidism can include parathyroid adenoma, parathyroid carcinoma, or primary hyperplasia. The disorders elsewhere in the body causing hypocalcemia, which further leads to secondary hyperparathyroidism, include chronic kidney disease, intestinal malabsorption syndrome, vitamin D deficiency, rickets, and osteomalacia. Also, do remember that in primary hyperparathyroidism, there is hypercalcemia. On the other hand, in secondary hyperparathyroidism, calcium levels are either reduced or are normal. Phosphate levels in primary hyperparathyroidism are reduced, while phosphate levels in secondary hyperparathyroidism are usually elevated. So this was all about differences between primary and secondary hyperparathyroidism. So this was all about primary hyperparathyroidism in brief. Here is the overview of what I have discussed. If you think this video was helpful, do like this video, share this video, and subscribe to my channel. Thank you.